Okay, my name's Sarah Canilau, and I'm going to be performing head-to-toe assessment for Nurse 130 Fall 2018. So as I enter the patient's room, first thing I'm going to do is I'm going to trace any lines that are connected to the patient, and trace it to either the IV line or oxygen, depending on where the lines end up. I'm also going to make sure that there is suction, oxygen, and ambu bag all in the room, and I'm going to assess the room to see if there's any clutter and if the bed was in the lowest position when I came in, to prevent any further fall precautions. So hi, my name is Sarah. I'm going to be your nurse today. Let me just check your ID band. Thank you. Can you tell me your name and date of birth?
Raul Donato, April 14, 1989.
Okay, thank you. And so Raul, how are you feeling today?
I'm feeling okay. I have a little bit of pain.
You have a little bit of pain? Well, what brings you to the hospital?
I'm here because I just had surgery on my right knee yesterday.
Okay, and then do you know what hospital we're at right now?
Grossmont Hospital.
Grossmont Hospital, and then do you know today's date?
It is 10/9/2017.
Okay, good. So you have a little bit of pain, so maybe on a scale from 0 to 10, you can tell me how much pain you're in right now?
It's a 2.
A 2? Okay. And then what's your tolerable level of pain, like maybe when you would need some pain medications?
A 4.
A 4? Okay, so you're feeling not too bad right now? Pretty tolerable? Okay, So that's good. Then I'm going to go ahead and just continue my assessment for today. So the vital signs were already taken and everything is within defined limits. So I'm going to go ahead and put on some gloves. So Raul, have you been experiencing any headaches, any change in vision, or a change in hearing at all?
No.
No? Okay, good. Alright. So what I'm going to do first is I'm going to check your eyes. And then if you could just look at my ear. So what I'm checking for now is constriction of the pupils. Okay, good. And then if you could stare at my pen light, and then stare at the ceiling, and then stare at my pen light again, and that's me checking for accommodation. So if you could go ahead and smile for me, and then go ahead and puff out your cheeks, and then stick out your tongue for me, and I'm making sure that everything is even in the face. I'm going to go ahead, if you could lift your head for me, I'm going to just feel the bony prominences and take a look to see and make sure that there's no pressure ulcers forming. So you can put your head down, and I'm going to go ahead and look to see if there's any JVD or any tracheal deviation. I'm also going to palpate the neck just to make sure that there aren't any enlarged lymph nodes. So Raul, do you smoke at all?
No.
No. Do you have any trouble breathing? No. No shortness of breath or anything like that?
No.
No? Okay. So what I'm going to do is I'm going to listen to your lungs, and then after, if you can sit up for me, I'll listen to your lungs on the back side, okay?
Okay.
While I'm in the front, I'm also going to listen to your heart sounds, okay?
Okay.
Okay, everything sounds good there so far. So let me go ahead and I'm going to lift up the bed a little bit. And then I'm also going to just put your bed up. Okay. Alright, can you lean forward for me? Alright. You feel okay doing that? No pain?
No pain.
No pain, okay. Okay, lung sounds are clear. And then while I'm back there, I'm also checking the integrity of the skin and the bony prominences to make sure that no pressure ulcers are forming. Okay, you can lean back. Thank you. Okay, I'm just gonna put your bed back a little bit more. Alright. So I'm gonna go ahead and palpate your arms, okay, and you tell me if you have any pain, numbness, or tingling when I go down. Any pain, numbness, or tingling?
No.
No? Okay, and then as I'm doing that, I'm also checking the integrity of the skin to make sure that there is no redness or swelling or any unusual bruising. Also, I'm checking the temperature to make sure that there isn't any increased warmth coming. And then if he has an IV, I'm also going to check the integrity of the IV site, and I'm going to lightly palpate and ask if there's any pain associated with that. No, and then I'm going to see if there's any increased redness or swelling around the IV site. So I'm going to check your hands, so any pain, numbness, or tingling? No, and then I'm going to also check for the cap refill, and it's nice and brisk.
Okay.
If you can go ahead and squeeze my hands, and it's equal, and then push on my hands, and then pull on my hands. Thank you. And then I'm also going to check both pulses to make sure that they're strong and even. Okay, and they're good. So as far as going to the bathroom, have you passed any stool since your surgery?
Last night.
Last night? Okay, good. And then so you're also passing gas?
Yes.
Okay, any trouble with that?
No.
No, so no pain when passing the stool. And then what was the consistency? Like soft formed, or was it hard, or?
Soft.
Soft. Okay, good. And then what's your normal pattern of passing stool?
Like twice a day.
Twice a day? Okay, good. And then any trouble urinating?
No, no trouble.
No trouble. When was the last time you did?
This morning.
This morning. And then was the color clear? Was it yellow? Or was it dark, cloudy?
Clear and yellow.
Clear and yellow? Okay, good. And then was it a little bit of the amount, or was it a lot, or it was
just
how
a normal
amount? Okay, good, great. Okay, so what I'm going to do is I'm going to go ahead and palpate your legs, and I'll be careful around your surgery site. Okay? And you tell me if there's any pain, numbness, or swelling in the legs. Any pain?
No, just on my right knee.
Just on the right knee. Okay, yeah. I'm going to take a closer look at it. So I'm also going to go to the feet. And any pain, numbness, or swelling here? No. I'm going to check cap refill of the toes, and it's nice and brisk. And then I'm going to check the dorsalis pulse to make sure that it's nice and even, and then also the tibialis pulse, and make sure that it's strong and even. So as I'm doing that, I'm also checking the skin integrity, make sure that there isn't any increased redness or swelling, to make sure that there's no DVT, and increased warmth would be a sign of DVT as well. And so now when I check the knee, I want to make sure that I'm assessing the surgical site, and I want to make sure that there isn't any excessive purulent drainage. If I could see the actual surgical site, if it's not covered in bandage, make sure that there's good approximation, and that there isn't any increased redness or swelling. All right, so I'm going to go ahead and put the bed down. Okay, and as I do my assessment, I also want to check other bony prominences to make sure that there isn't any pressure ulcers forming. Do you have any questions for me, Raul? Anything
no.
Concerning you?
Not really. No.
Not really? Okay, at home, do you live in a 1-story or 2-story house?
Just a 1-story
One
house.
story? Okay, that's good. So you don't have to be climbing the stairs. Do you have someone at least to help you move around the house?
Yeah, I have my wife.
Your wife? Okay, and your wife is pretty knowledgeable. Like, is she coming to you? Did she come to you with a surgery, and she came with you?
Yeah, she was here earlier.
She was here earlier, and she'll be here later. Okay, good. That's good to hear. So if you have any questions, or if you need anything, or if you feel like the pain is coming in a little bit stronger, I'm going to leave the call light here with you, and then you give me a call. If not, I'll go ahead and check on you within an hour.
Okay.
Okay.
Sounds good.
Thanks, Raul.
Thanks.